Good evening. My name is Meg Wheeler. I am a candidate for the state senate in the Massachusetts, Plymouth, and Norfolk District, and I'm here tonight to give you an update on the COVID-19 pandemic. So in terms of numbers here in Massachusetts today, an additional 4,870 tests were completed. That brings the statewide total to just over 56,600. In terms of cases, we are now up at just under 9,000, 8,966 cases. We saw an additional 1,228 cases today. Very sadly, in terms of deaths, our statewide total is now at 154. We saw an additional 32 deaths today. Across the United States, we now have over 234,000 positive cases of COVID-19 with over 5,700 deaths. Worldwide, there have been over 1 million positive cases with over 50,000 deaths. So obviously, we are seeing these numbers increase considerably as the crisis continues. From a state update perspective, Governor Baker today issued an order closing all parking lots of coastal beach reservations. That includes drop-offs, so you are no longer able to go drop people off at the beaches if it's a state-owned parking lot. The beaches, however, will remain open if you can get there, but only for activities like walking or fishing, not for sunbathing or just sitting around hanging out. The Department of Conservation has announced in response to that they will open select state parks early and expand access to others so that people can get out, go for walks and whatnot, but that they will be limiting the availability of parking at the more popular parks. I am continuing to hear from folks that the parks are overcrowded. There are lots of people still in groups. So as much as I know we all want to get out there, I do caution you to avoid areas that have a lot of people and to make sure that if you are going out, that you are still practicing social distancing in those areas. So Governor Baker also announced today that the Boston Convention Center will become a field hospital. They expect it to have 1,000 beds. 500 of those beds will go towards the city's homeless population, and the additional 500 will be overflow patients from hospitals. We're now expecting the peak here in Massachusetts to occur sometime between April 10th and April 20th. This is a slight shift from before when we thought it would be between the 7th and the 17th. Modeling does suggest that cases could get as high as between 47,000, anywhere up to 172,000 cases, or just under 1 to 2.5% of the population. Governor Baker said that the state's current fatality rate is 1.5%. That's lower than many other parts of the country and the world. And that 80% of infected people have flu-like symptoms, and many actually do not have visible symptoms at all. This is why it's important that even if you are feeling okay, that you still stay at home as much as possible. The governor said that he believes we will both need more beds and more ventilators to manage this anticipated surge. So previously it was reported that Massachusetts was approved for 1,000 ventilators from the federal government. The HHS secretary today told the state said that the state had previously requested these ventilators. We actually increased the number we requested, but so far we have not received any of the 1,000 ventilators that we have requested and been approved for. 3 million masks that we ordered were confiscated in the port of New York apparently by the federal government. The state worked with Patriots owner Robert Kraft to have over 1 million masks flown in from China. Those are expected to arrive today here in Massachusetts. In some good news, Partners Healthcare has been able to obtain an N5 decontamination system. This should be in operation by Monday, and it can decontaminate 80,000 masks per day. So this will go a significant length to help us manage the mask shortage here in Massachusetts that we've been facing. On the federal level, President Trump has invoked the Defense Production Act. It gives the federal government the power to influence domestic industry to produce supplies, such as masks and PPE, and ensures that these companies have the materials they need in order to do so. Treasury confirmed today that Social Security recipients will automatically receive their stimulus checks. Previously, it was suggested that you would need to file a tax return to receive one. It is not the case. If you are a Social Security recipient and you qualify for a check, then you will receive that automatically. There was a memo from House Ways and Means Committee today on the checks. So Treasury has said that stimulus checks will not start going out until April 13th. It's expected that folks who have direct deposit bank account set up with the IRS system will have their checks at about that time. The IRS expects to start issuing paper checks on May 4th for those whose bank account information is not in the system. However, because of how long it takes them to print checks and the number of checks that would need to be printed, it could take up to 20 weeks to issue all of these checks. They'll start with individuals with the lowest income based on adjusted gross income on your tax return, and it'll go up from there. So the memo does note that these timelines are subject to change. They estimate that 150 million people are eligible for stimulus checks, but that they only have bank account information in order to direct deposit for about 70 million people. That leaves 80 million checks that they will need to print and mail. So the IRS is working on an online system estimated to be ready in late April or early May that would allow taxpayers who do not have their bank account information on file to go online and add that in or update it if it's outdated. This system will also allow you to track the status of your payment. So I would highly recommend, if your bank account information is not on file with the IRS, that you go, once the system is released, that you go in and add your bank account information to significantly reduce the time it'll take for you to get a check. Lastly, Speaker Pelosi has created a bipartisan House committee to oversee the federal response of the coronavirus pandemic. So their focus is on ensuring that our taxpayer dollars are being spent wisely. This committee, however, is not formally created until the House votes on it, which they, of course, cannot do because they are not currently in session, as they are at home practicing social distancing. So more to come on that. There are also talks underway for a fourth stimulus bill focused on infrastructure and job creation. Trump has expressed some support for an additional $2 trillion infrastructure package, likely over the next 10 years. And in terms of State House news today, 34 state officials, including 2 state senators, Senator Eldridge of Acton and Senator Roush of Needham, joined together to send a letter to Governor Baker requesting the following. So it requested an order to shut down all non-essential construction, to establish a process for workers or members of the general public to formally request that a particular job or service be removed from the essential services list. So right now there is a process through which someone can apply to be added to the essential services list. This would give people the opportunity to remove themselves or ask that other businesses be removed. And they're also asking Governor Baker to issue a stay-at-home order instead of what is currently an advisory. This would continue to allow residents to get the essentials, grocery stores, medical care, things that they need, but would be more aggressive in our fight to stop the spread of COVID-19. So Massachusetts has already taken some good steps, like shutting down non-essential businesses to slow the spread, but I stand with the 34 state officials to call on Governor Baker to take more aggressive action. We have already seen signs that our actions are having a positive impact, but we need more and we need it fast. And frankly, we need something that ensures that everyone respects this request and this urgent need to stay at home, and we're just not seeing that respected by all community members at this point. So I encourage all members of the public who believe we need to do more to call your elected officials and Governor Baker and ask him to take further action. And then lastly, just a reminder, please go to redcross.org where you can sign up to donate blood. The hospitals are still very much in need of that. So to wrap this up, we do, of course, have our COVID-19 resource page, which is megwheeler.com/COVID. You can always reach out to our campaign with any questions, megwheeler.com, hello@megwheeler.com, or you can message us on social media. As always, I want to just wrap this up by saying how incredibly grateful we are for everyone who is out there fighting this on the front lines, from our medical professionals to our first responders, to our grocery store workers and gas station attendants, and our folks in the pharmacies, everyone who is out there ensuring that we have what we need to get through this. Thank you, truly thank you. So I hope everyone is staying safe and healthy, and we will be back here tomorrow night for another update.